Hello, everyone, and thank you for being here today. I'm excited to kick off this important presentation on cancer of the cervix. Prevention starts at age 9. In the next few minutes, we'll explore how early prevention can make a real difference, including key strategies and the vital role of vaccination. We'll also look at what parents, caregivers, and communities can do to protect young girls and ensure a healthier future. So let's get started. Every hour, in India, around 9 women lose their lives to cervical cancer. That's a really sobering statistic, and when you break it down, it amounts to nearly 80,000 women each year. These numbers are based on data from the International Agency for Research on Cancer from 2021. What this highlights is the urgent need for awareness, early detection, and effective prevention strategies. It's a stark reminder of how significant this issue is in our country, and why addressing cervical cancer should be a key focus in improving women's health overall. Let's take a closer look at what we mean by cancer of the cervix. Essentially, it's a disease that develops in the opening of the womb, which is also known as the cervix. Now, this area is a crucial part of the female reproductive system, connecting the uterus to the vagina. What's important to understand is that all women who have a cervix are at risk of developing this type of cancer. It's not limited to a specific age or background, so awareness and regular screening are key for everyone. And just a quick note on the image you're seeing here. It's credited to Cancer Research UK, highlighting the importance of research and awareness in tackling this disease. Overall, understanding what the cervix is and recognizing that any woman with one is at risk helps us appreciate the importance of prevention and early detection. This is a vital part of the overall conversation about women's health and cancer prevention. Let's talk about the symptoms of cervical cancer. One important thing to understand is that this type of cancer often develops very slowly over many years. In the early stages, there may be no noticeable signs or symptoms at all, which is why regular screenings are so crucial. As the disease progresses to more advanced stages, certain symptoms become more evident. One of the most common is abnormal vaginal bleeding. This could happen between periods, after intercourse, or even after menopause. Another key sign is an unusual vaginal discharge. Sometimes, this discharge can contain blood and may occur outside of your regular menstrual cycle. It's important to pay attention to these changes, as they can signal something more serious. Pain during sexual activity is also a symptom to be aware of. If you experience discomfort or pain during intimacy, it's worth consulting a healthcare provider. Overall, these symptoms highlight why early detection through screening and awareness are so vital. Recognizing these signs early can make a significant difference in treatment outcomes and overall health. Now, let's talk about a key fact that really highlights the connection between HPV and cervical cancer. Almost all cases of cervical cancer are caused by human papillomavirus, or HPV for short. This is a very common virus, and it's actually one of the most widespread sexually transmitted infections. What's important to understand is that HPV infection is usually asymptomatic, meaning most people don't even know they have it. However, in some cases, the infection persists and can lead to changes in the cervical cells over time. These changes, if left unchecked, can develop into cancer. That's why HPV is considered the primary cause of cervical cancer. Understanding this link is crucial because it underscores the importance of prevention strategies like vaccination and screening. Throughout this presentation, we'll see how addressing HPV can significantly reduce the risk of developing cervical cancer, making it a key focus in women's health initiatives. So, recognizing that almost all cervical cancers are linked to HPV helps us understand why prevention efforts are so vital. Human papillomavirus, or HPV, is actually one of the most common viruses out there. It's so widespread that most people will encounter it at some point in their lives without even knowing. Now, what's important to understand is that there are many different types of HPV. Some are harmless and go away on their own, but others can pose serious health risks. In fact, a few specific types of HPV are linked to the development of several types of cancers. These include cancers in both men and women, like cervical cancer, which is well known, but also cancers of the vulva, vagina, penis, anus, and even the throat. What makes this particularly important in our overall discussion is that HPV is not just a minor infection. It's a leading cause of certain cancers. That's why prevention, early detection, and vaccination are such critical tools in reducing these risks. So, understanding that HPV is so common, yet has the potential to cause serious health issues, really underscores the importance of awareness and proactive health measures. HPV infection is actually very common, and it affects both men and women pretty equally. In fact, most people will get an HPV infection at some point in their lives. The tricky part is that most of these infections don't cause any symptoms, so you might not even realize you've been infected. The good news is that our bodies often fight off HPV on their own, clearing the infection without any treatment. But it's important to remember that not all infections are so easily resolved. Some can persist and potentially lead to health problems down the line. And speaking of treatment, there's currently no way to directly cure an HPV infection once you have it. That's why prevention, like vaccination and regular screenings, is so critical. It's all about protecting ourselves and those around us from the broader health risks associated with HPV. Now, let's talk about how HPV is actually spread. HPV is transmitted through intimate skin-to-skin contact, which means it doesn't require sexual intercourse specifically, but close contact is enough. Importantly, it's not spread through blood or bodily fluids like saliva or blood, so everyday activities are usually safe. You can't get HPV just by shaking hands, hugging, or holding hands. Those are not ways it spreads. Also, activities like swimming in pools or ponds, sharing food or utensils, or being unclean do not transmit HPV. It might seem obvious, but it's important to clarify these misconceptions so we understand what truly puts us at risk. The most effective way to prevent HPV infection is through vaccination. It's a safe and proven method to protect yourself. And here's something crucial to remember. People can have HPV without showing any signs or symptoms. That means you could be infected and contagious without knowing it, which is why prevention and vaccination are so important for everyone. This highlights how important it is to stay informed and proactive about your health. Now, let's talk about some effective strategies to prevent cervical cancer. One of the most important tools we have is HPV vaccination, which is ideally given to young girls around ages 9 to 14. This vaccination helps protect against the human papillomavirus, which is a major cause of cervical cancer. Starting this vaccination early is crucial because it offers the best protection before any exposure to the virus occurs. For adult women, screening remains a vital part of prevention. The recommendation is to have cervical cancer screening twice in a lifetime using a high-performance test. Typically, this is done around age 35 and then again at age 45. These screenings can detect precancerous changes early, allowing for timely treatment and preventing the development of cancer. This approach, vaccinating young girls and screening women later in life, aligns with the global effort led by the World Health Organization's Cervical Cancer Elimination Initiative. The goal is to significantly reduce the incidence and mortality associated with cervical cancer worldwide. In essence, these strategies work hand in hand. Vaccination reduces the risk of HPV infection, and screening catches any issues early, making cervical cancer largely preventable. It's a comprehensive approach that can save many lives if implemented effectively. Now, let's talk about HPV vaccination and how it plays a crucial role in preventing cervical cancer. HPV, or human papillomavirus, is a common virus that's responsible for the majority of cervical cancer cases. The good news is that we have a vaccine that can effectively protect against the types of HPV most often linked to cancer development. Getting vaccinated against HPV is a powerful preventive measure, ideally before someone becomes sexually active, to reduce their risk of developing cervical cancer later in life. It's a proactive step that, along with regular screenings like pap smears, forms a comprehensive approach to cervical cancer prevention. So, when we think about the overall theme of prevention, HPV vaccination stands out as a key strategy. It's not just about protecting individual health, but also about reducing the overall burden of cervical cancer in our communities. Emphasizing vaccination as part of our health initiatives can save lives and improve long-term outcomes. Now, let's take a closer look at some important facts about the HPV vaccine. First, it's reassuring to know that the HPV vaccine is very safe. It has undergone rigorous testing and monitoring to ensure it's safe for most people. Side effects are typically mild, like a sore arm or a slight fever, and serious reactions are extremely rare. Next, the vaccine works very well. It's highly effective at preventing the types of HPV that cause most cervical cancers and other HPV-related diseases. Vaccinating early means we can significantly reduce the risk of these cancers developing later in life. Speaking of timing, vaccination actually starts at age 9. That might seem early, but it's the optimal time to get protected before any potential exposure to the virus. Starting at a young age ensures the immune system responds strongly, providing the best possible protection. So, when we think about overall cancer prevention and public health, these facts highlight just how crucial HPV vaccination is. It's a safe, effective way to protect not just individuals, but the community as a whole. Now, I want to emphasize an important step in protecting our children's health, giving them the HPV vaccine starting at age 9. This isn't just about preventing a virus, it's about safeguarding their future. The earlier we vaccinate, the better protected they are before they're potentially exposed to HPV through new experiences and relationships. It's also worth noting that the dose schedule is designed to be most effective when administered at this age, ensuring they build strong, lasting immunity. And as we talk about models used here, I want to clarify that they're just for illustrative purposes, highlighting how early vaccination can make a real difference. Ultimately, taking action now by vaccinating at the recommended age is one of the most proactive steps we can take to protect children from HPV-related cancers later in life. It's about being responsible and doing what's best for their health and well-being. And here we are at the end of our presentation. I want to take a moment to thank you all for your attention and engagement throughout. We've covered a lot of ground, from the initial challenges to the solutions and strategies that can make a real difference. Remember, the key points we've discussed are not just standalone ideas. They connect to form a bigger picture of how we can improve and innovate in our field. It's important to carry these insights forward and think about how they apply to your own work. So, as we wrap up, I encourage you to reflect on what resonated most and consider how you might implement some of these concepts. Thank you once again for your time, and I look forward to seeing how you all take these ideas further. And that brings us to the end of our presentation. I want to thank you all for your attention and engagement throughout. Before we conclude, I've included an appendix of additional questions. These are meant to spark further thinking or discussion. They're not just extra, but they tie back to the core themes we've explored today, like innovation, strategy, and continuous improvement. Remember, the real value often lies in asking the right questions, so feel free to revisit these or come up with your own. Ultimately, I hope this session has provided you with insights and practical ideas to take into your work. Thanks again for being part of this, and I look forward to seeing how you apply what you've learned. So, you might be wondering, does the HPV vaccine cause side effects? Well, I want to reassure you that the HPV vaccine is considered very safe. Like any other shot your child might receive, there is a chance of mild side effects. These are usually just things like a slight fever or some redness or swelling at the injection site. It's important to remember that serious reactions are extremely rare. In very rare cases, a child could have an allergic reaction, but that's why we always monitor them for about 10 to 15 minutes after the shot. This helps us quickly address any unexpected issues and ensures your child's safety. Overall, the benefits of protecting your child from HPV-related health problems far outweigh the small risks of side effects. Our goal is to make this process as safe and comfortable as possible, so you can feel confident in the decision to get this important vaccine. So one common concern I hear is whether getting the HPV vaccine might harm a girl's future fertility. And I want to assure you, no, it does not. There's no evidence to suggest that the HPV vaccine causes any fertility problems. In fact, the opposite is true. The vaccine actually helps prevent most cervical precancer and cervical cancer, which can have serious impacts on a woman's reproductive health if left unchecked. So, by vaccinating your daughter, you're not only protecting her from potential cancer, but you're also safeguarding her ability to have healthy, future pregnancies. This is a key part of why vaccination is such an important tool in promoting long-term health and well-being. So, you might be wondering, are HPV vaccines safe? And the answer is a confident yes. Just like any other vaccine you receive, HPV vaccines are very safe. In fact, they have been administered to millions of children across more than 100 countries around the world without serious issues. What's really important to know is that these vaccines are among the most studied vaccines out there. Extensive research and ongoing monitoring confirm that they are very safe for everyone. The safety data is clear and reassuring, and it's a key part of why vaccination is such an effective tool in preventing HPV-related cancers later in life. This ties into our overall message. Vaccination is a safe and proven way to protect health. When we talk about preventing serious diseases, safety is always a top priority, and HPV vaccines have a strong track record in that regard. So, to address the question, can boys get the HPV vaccine? Absolutely, yes. The HPV vaccine is recommended for both boys and girls. It's an important step in protecting everyone from HPV-related health issues later in life. Many people think of HPV as only affecting women, but in reality, it can cause cancers in both males and females. By vaccinating boys, we're not only safeguarding their health now, but also helping to prevent the spread of the virus overall. This ties into the broader theme of this presentation: how vaccination is a critical tool in preventing serious diseases and promoting long-term health for everyone. So, whether you're a parent or a young person, understanding that the HPV vaccine is for boys too is key to making informed decisions about health and prevention.